My name is Jimmy Norman. I'm the administrator for EAMC Lanier Ambulatory Surgery Center. It's located in Valley, Alabama, which is near Auburn and right by the Georgia line here in Alabama. Lanier ASC is we've been in business a little over 2.5 years, so we're still new to the game. Our main specialties are multi-specialty. We do orthopedics, we do general surgery, we do gastroenterology, endoscopy, and we just recently got into the eye business with having some retinal and cataract surgeons starting to do cases out there that we're really excited about. We've been using since the beginning. We actually chose a HST right out of the gate. Started using it. We use the PM product. We use the EHR product. And then we also use Clarity. And we just wanted to have all those integrated working together to provide the best solution to our center as we were getting up and going again 2.5 years ago. As we were trying to look at products to utilize in our center, we were trying to make sure, and knowing several of the players, our surgeons that we're going to be using, we were trying to look for something that would be easy to use, would be intuitive, would allow them to see and treat patients from start to finish as quickly as possible and easily as possible. We were also doing our vetting process with a sister ASC. I failed to mention we are actually a joint venture between East Alabama Medical Center and a group of surgeons and gastroenterologists. So we were trying to, as well as the one in Auburn, trying to find something that would be a good fit, that both centers would be comfortable with. And again, knowing the doctors involved in my group, trying to find something that would be ease of use and or easy to learn for them as they're trying to learn different systems at different locations. We knew we were going to have to invest in a PM product to, from a billing standpoint, to do the billing. In our system at the surgical clinic, my doctors were already used to an EMR type of environment. They're also used to working in the hospital, even though they use Cerner. They're used to working in an EMR environment. So to basically ask them go back to paper, I think was a step back. And and some of these are seasoned doctors. They're in the sunset of their career, but yet their willingness to jump in, and also our ability to show them how intuitive it was, by using the mic for them to be able to dictate into their note and complete their note in a timely fashion. It was just a no-brainer for us to go in that direction. And as we vetted other products, HST just kept rising to the top as far as the one we wanted to go with. We were looking at different solutions. HST just kind of jumped off the board right away. It was very intuitive. It was easy to follow the flow process. I love the fact that it basically quote required the doctors to complete their chart before leaving for the day. And I know dealing with other systems and paper charts and so forth, things get lost, that impacts billing. And we were just looking for something that would make that move along quickly, make us productive and profitable right out of the gate. And as we compared to other systems, it was just a no-brainer for both us as well as our sister ASC. We met with our board, and we actually targeted and had a couple of members of our board be on the selection committee, and to a person, they were very impressed with HST and just saw that it would be an easy adopting of the system. And when we went back to our board, we had a unanimous choice to go forward with HST. We've actually have recommended it to other organizations already. We've actually had some on-site visits come to our center to see it in work and in progress. Um, I think again, the main thing that I've always told folks is the ease of physicians catching on to the system and being able to maneuver and be able to use it. We actually last summer had to have some uh, anesthesiologists come in that were working locums for us, and they commented how easy the system was for them to work in and get up to speed on. So again, that just confirmed and affirmed our decision was the right decision. Usually, it just took one of my nurses sitting down with the doctor, kind of holding his hand through the first patient. Then after that, they were off walking on their own and taking it from start to finish on their own from the get go. So again, it's been very impressive in how easily everyone adopted to the new system. I think number one, I love the fact that the system is easy to navigate, easy to for the doctors to work through. That moves into number two. It allows them to complete their chart on the same day of service. We have zero open charts and we use that in our review process and as well as in our accreditation to let folks know, we have zero charts that are still open. We have 100% closure. And then that translates into profitability. When those things happen, it gets bills out quickly, it reduces AR, and just helps that whole process move along to a completion of the cycle of that patient encounter. So I think those three things have just kind of jumped off the page to us as an organization. I think for us, quantitatively, it's out of the gate knowing our AR days are going to be low to start with, and again, that starts with that full patient encounter. In a paper chart system or other systems, you're waiting on doctors to complete notes, which delays the billing component. So we knew out of the gate that was going to help us. Again, with chart closures, knowing that that's going to be done at the end of the day. Um, Cost saving wise, knowing there's not a lot of add on products that you have to bring to the equation. A lot of, I know in our system, elsewhere, we've had to use faxing solutions or other document management solutions, or and so forth. All that's included, and then too, with us being able to have clarity as part of the HST solution, has definitely helped on the front end of being able to collect from that patient prior to the engagement. Them not being, especially now with the No Surprise Act, them not being surprised that they have a co-insurance amount due or copay due, and then just being able to facilitate that from the start has made us get out of the gate quicker and not having to recreate wheels. I know I've looked at some other solutions that y'all are going to be adding in the near future that I'm excited about, the dashboard and some of those type things that I think will give us an immediate notice, kind of what's going on with our organization. So I definitely see HST, and as they've reached out to tell us about other enhancements, I'm encouraged that they're not just sitting on their laurels saying, "Hey, we've got a good product, let's just ride, the pine." They're trying to find other ways to help their customers and help us grow, help us find solutions, help us cut costs, and that's encouraging to know they're a partner and not just a vendor to us. For us, it was kind of different. We were during year 2020 and dealing with COVID, so all of our training and all that was done through Zoom and remotely. But I must admit, it was pretty painless, which was surprising. The team did a great job of interacting, providing us homework, making sure we got things accomplished, making sure we were staying on the timeline we need to be on, and making sure as we were getting ready to open and bring on staff that we were prepared for them. Great job in training our staff and getting them up to speed. And again, I think also a lot of that just goes back to the intuitiveness of the system that everybody caught on quickly and we got out of the gate running and not having to crawl. We started out running. Unlike some other softwares I've been on, I haven't had to fool with customer support too much. So, that's been a nice plus. And the fact that in our contacts with them, they've been able to get resolution to the issues, but those have not been very often. So that's another plus is the system works as advertised. There's not a lot of support issues, and 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 also if HST does see something that's kind of coming at them, they are very proactive in letting us know, hey, we're going to have to do an update, or we're going to have to, fix this, or hey, we're having server issues at on a global level, and so it might be impacting you. So they are proactive in letting us know, if there's anything that might be more global and not just even related just to our system individually. We started using it from the beginning. We were able to provide them our contracts for billing, insurance contracts, and so forth, which they got loaded in the system. And then as we have booked our cases, we put that information into the system. Uh, Clarity then uh, through HST, it reaches out to the patient, lets them know what their kind of checks the insurance, lets them know what they're going to owe us, so that they can go ahead and pay before they arrive to the center, or be prepared to pay at the center. If we find ourselves also needing to put them in some kind of payment arrangement, just due to the maybe the type of balance that might be incurred, Clarity helps us get that put in place and so forth. So anyway, it's been a great solution. I know they're working to improve that as well, and so we're looking for those enhancements to utilize in the patient engagement as we move out in the future.